My wife is a periodontist, and she took this Millennium course 2 years prior to me taking the course. She came back really satisfied that she was doing something very good for people. 2 years afterwards, she said, "You have to do this, because if you don't, you won't be on the leading or cutting edge of dentistry and medicine." Well, first, I have to tell you that I was very skeptical about LANAP, because as a general dentist, you need to have the periodontal surgery done so you can do your prosthetics. And I said, I know what I've got. After 8 weeks or 10 weeks, I know what I have, put people in temporaries, and 2 months from then, we're going to put them in final restorations. So I had a known entity, then I went to an entity that had no idea what it was going to be like. The protocol of LANAP meets my expectations and more. It's actually a very surprising end result. When you see it, you're wondering, how can light do this? And after a few cases, you sit there and you go, that's actually healing. I'm actually getting bone growth back. And in my practice, when I have patients come to me, they want dentures or partials. They want me to take teeth out. They want me to make bridge work or whatever I can, place implants to replace missing teeth. And to me, the best and most rewarding thing is to tell them, I can keep your teeth. We may have to do some crown and bridge or prosthetics, but we can keep your teeth right the way they are. There are many factors that make LANAP unique, and that is, number one, you don't have to have a scalpel blade and you don't have to have sutures, and the pain, the postoperative pain, is almost non-existent. A few Advil or Motrin, whatever you choose to take, and some Tylenol usually takes care of all the pain that a patient will ever have. All my patients, barring none, come to me with the thought process they're going to lose their teeth. And when they leave, there are tears of joy 90% of the time. And then after a year or even 2 years after having the procedure done, they're still amazed at how good their teeth feel without major intervention. Smokers are big in my practice. And I would say smokers and diabetics are more common these days. Plus, what's already been talked about before me, and that is patients with heart problems. So all these medical conditions that were never a big part of dentistry 32 years ago are now a major part of what I do every day. And so when you think about doing surgery on somebody for periodontal disease, you want to make sure that you haven't overlooked anything medically. And the one thing that sticks out in my mind are patients that have blood thinners on board for heart problems and issues. You don't want to have that medicine taken away. You don't want to have a severe event if I take it away to do something for gum disease. And so we can do LANAP and LAPIP without taking them off their Fosamax, without taking them off their blood thinners. So it's a great advantage to us, and it's a great advantage to the patient that they can feel comfortable, that they're going to walk out of there having something that's going to help them. And then when my patients started having problems around some of their implants, which was highly unexpected, I've been doing it for 30 years, you didn't expect to have problems, then all of a sudden you have a problem and you say, oh, I want to take care of this because I don't want to have to take it out. That was the key issue for me right then, when I could say to the patient, we can keep this implant, where we couldn't keep it before. LAPIP is a very interesting procedure. We have a metal implant placed in someone's mouth, and all of a sudden the tissues around that implant are not working properly. The tissues around an implant should keep a tight fit around that, and the bone should be well adapted to an implant. So when we lose this situation, there are only several things we can do. Number one, do traditional surgery, but we end up losing more bone and more tissue and show some of that implant. We seldom can save an implant for any length of time once those threads are exposed. But with LAPIP, we actually leave the tissue at its present height, clean the area very, very well without disturbing the coating on the implant, and we're able to get bone growth back. It's an exciting proposition for a patient not to lose that implant and feel like they can keep it a lot longer.